तो उधर बेटर है।
कैमरा में आप नहीं लेके जाओ, ठीक है? कैमरा ज़्यादा अच्छा करता है, देख जा सकते हैं वो कनेक्शन नहीं है तो अभी then I give it this had to be do it in the
This comes like this. Hello, hello. So here is a case of around 5 to 6 millimeter pockets in single tip, that is 1/6 and 1/7. So what we are going to do with we have two choices here. Either we can press this red button. Just a minute, I'll show you. This is up. Either you can press that center red button. Can you see this red button? The red it is written 640 nanometer. If you want, sometimes if you have only one dye, no blue, you don't have this. So then you can press the red button 640 nanometers because it is the methylene blue, right? And you can use this. The biological effect will be same. The results will be same. It depends on what you have at your discretion at that given period of time. Whenever it is a high profile patient or high aesthetically concerned patients, always use indocyanine green. And in not more posterior teeth, you can target this. Anteriors, most of the time, patients are concerned about their aesthetics. So you would rather go for indocyanine green because it doesn't stain much. This will stain for a longer period of time. Make the patient very clear what you are doing, and rather he must not blame you कि आपने पहले क्यों नहीं बोला ऐसे मुझे. After doing a PDT, you can irrigate with the water, but you can't completely remove that stain that lingers for a longer time, right? So which one will start? Green? Okay. All are high profile doctors here. Get me on syringe. Whatever. If you're using this green, press this first password. It is by default it will go by to ENA 10 only. If you consciously want to convert it into 6, it will go here 640 nanometer. It starts with 50 milliwatts. What the dose I showed that 100 milliwatts into 60 seconds. 50 milliwatts in say 6 joules exactly, right? So now you know the calculation part how to do it. It is 100 into 60 seconds, 100 milliwatts. ये देखिए यहाँ पे जस्ट यहाँ पे 100 दिख रहा है सभी को. 100 milliwatts. यहाँ पे 60 seconds दिख रहा है, तो 106,000 millijoules is equal to 6 joules. So if you want to make it now 200 into 60 seconds, 12 joules. Now tell me 200 into 30 seconds it is. Again it comes to 6 joules. So when chronic lesion, start with as low energy as possible and slowly feed them. As I gave the example yesterday, that if I am on a 8-day hunger strike or something, fasting, I can't have a 3-course meals on the 9th day and hog everything. I have to be slowly fed, my energy levels has to come slowly back, and then only I can have heartily a good meal, right? That's the same with, you can't push up the energy into the cell and jaldi se theek ho jaye, ऐसे नहीं होता, right? So always, if you want to have less now, it will become how much? Yeah, 3 joules, half of 6 joules. So you slowly, as you start your journey into the laser dentist, no, you'll slowly start to analyze how much joules is required, how much is not required. Slowly you understand the knowledge, the science behind using. So if you want to, 6 joules is what we tell all the patients, because that's where we, if you want to use this same on the patients, 6 joules again will be little higher. So convert it into 30 seconds.
तो feeding pockets we don't have
200 milliwatts into 100 seconds, right? Or 300 milliwatts into 60 seconds. You can keep anywhere. If the pockets are really deep, make it 300 milliwatts into 60 seconds, up to 6 mm. If it is shallow pockets, not much of energy is required there. So आपको ऐसे permutations combinations जैसे जैसे आप start करेंगे ना, आपको पता चल जाएगा. अगर really deep है तो आप 6 जूल से कुछ हासिल नहीं कर पाएंगे. 6 मिलीमीटर है तो आपको 300 milliwatts रखना पड़ेगा. थोड़ा shallow है तो 200. You keep on playing and you'll get the results, right? Number of sessions for PDT in pocket, one session is more than enough, because the intention of us doing the PDT is elimination of all the organisms. You can't claim that only 50% of the organisms will eliminate this time, rest 50. So this IQ and general knowledge will start slowly making sense once you start using lasers, right? PBM you can for chronic conditions at least 6 sessions. PBM, photobiomodulation, right? Gloves. Very beautiful science behind this. They are already enough PubMed articles on remineralization. They have. Praveen Arne, what sir mentioned you, he is doing the research on the same. He is growing the remineralization of enamel. You can claim further going. They already have enough articles on remineralization and tertiary dentin formation. So if the caries is little deep, you can lace it and the dentin. Exactly. This बढ़ते जाएंगे ना, most of them was follow WLT guidelines, that is World Association of Laser Therapy guidelines. So it is free for everyone. Go there, see the systemic review articles, meta-analysis, and will come to know what exactly you use. And if there is any problem, you all have my number. You can already click a patient's photo and tell me, give me the history of the patients. I will be there to guide you. Not an issue. And then calling me. No, I pick up the course. That's the journey of a laser dentist. Actually, it goes like that. Once you start gaining knowledge, no, why do you call again, right? Rent. No. What happens? No, that's this one. But what happens? Something happens with the machine. Who is responsible?
The company is different.
I can't go roam around all over India sending a representative. It will be little.
Yes. Yes.
We are not at the private. I spoke to Arpita ma'am, and we have agreed to do one more hands-on course on patients individual, maintaining only 8 to 10 participants per course.
Sometime in future or
Sometime in future, in another 2 to 3 months. Yeah. So if you have enough cases in your clinic, you can do it there also. Or offer it.
but you will have to buy it.
You can never do Windows on thinking that
Can you elaborate this idea? Suppose
you can increase the number of your patients just by starting this one, and you have the advantage of first mover advantage in your area. When nobody is doing, then only you must start.
suppose we have
अभी सभी को बिस्लरी क्यों बोलते हैं? कुछ भी पानी हो बिस्लरी बोलते हैं.
तो Colgate बोलते हैं. Then to be need buy the machine or
By earlier it was 8 lakhs, 9 lakhs. Now we have come to around 2.29, 3.29. Cutting if you want a single value, no, 8 and 10 nanometer, we can do everything. 2.29 plus GST. That's all. It has come drastically down because no, if you're speaking to a CEO, I will see that somehow that GST part will be taken care of, not in the dealers. If the dealer comes in between, no, we have to give that commission to that.
that dual wavelength you will tell us. Then both three of
This is 8 and 10 and 640. This is the dual wavelength.
this is what you are telling 2.5.
This is 3.29. 2.29 is single wavelength. सब रहेगा, सिर्फ रेड पार्ट नहीं रहेगा, सब रहेगा.
PBM और थोड़ा कम.
6 हाँ है ना वो अभी उसका प्राइस बोलता हूँ. First understand the difference that if it is a superficial lesions, it's most of the time 640. Therapeutic 8 and 10 nanometer, even though the depth of penetration is little deeper, you can still use PBM and get the desired results. It is not that you are handicapped just because you don't have 640 nanometer wavelength, nothing like that. You can still start your journey with 8 and 10, you will definitely get the results. The one which I showed on the lateral border of the tongue, that needed a 640.
Yeah.
I have given the very good results in 4 to 5 days with 8 and 10.
By increasing the distance or decreasing the time, or maybe
Exactly.
combination also.
Playing here and there.
And how about breathing?
What is cutting that can be done 8 and 10 में हो जाएगा. हाँ. That's what I told you. One ideal wavelength where you can do all the PBM, PDT and cutting. 8 and 10. My journey is also started like that only with 8 and 10.
Everybody can't do everything.
Exactly. And you can achieve the results just reducing the time. You can reach it. It isn't that if you don't have 640, you can't do PBM, nothing like that. As you get experience enough 3 to 4 years, then you can always think of upgrading it. You keep one thing in mind, you are not handicapped by using single wavelength. You still can do all. Cotton is not kept today. Pen wala. You will be handicapped there. Huh?
Then you
You will be handicapped there. You can't cut the tissues if you are using that pen. No. He is from Calcutta. He does. Okay. He practices laser dentistry. Okay.
Not this way.
Okay.
आपके पास है मेरे 5 days का डेट पोर्टेबल मत.
फिर इसको बंद करना पड़ेगा.
मेरा बस नहीं था.
Professor Kana. See, this is the. I taken more. Actually, this much is not required because it is single pocket. Don't. I will show you how to save on the die also now. Exactly. Enough. This much is more than enough, right? Not mirror. Somebody should stand here on representative from department. This is the teeth. I will go 3. Deposit 1 drop. Go to the interdental papilla. Deposit 1 drop. Go to the buccal again. Deposit distal interdental again. Same base of the pocket. 1 drop. And even if you place sometimes what is deep, even if you place it at the buccal, it will seep into interproximal. तो आपको विथ एक्सपीरियंस आ जाएगा यहाँ पे मुझे डिपॉजिट करने की जरूरत नहीं, यहाँ पे ऑलरेडी गया है पॉकेट ज़्यादा डेप्थ नहीं है तो यहाँ पे ऑलरेडी गया है, नी नॉट हैव टू वेस्ट दैट अगेन 1 more drop, राइट. कीप ऑन प्लेइंग. LANAP procedure, if you know, laser assisted new attachment procedure, that has to be used only with 1064 nanometer wavelength in the DIAG laser, because one of the researchers did a publication on 810 and 940 and said it is a LANAP pure suit because it is only has to be done with 1064 NDI. And if you want to go one step ahead of this, there is something called Emundo technique, EMUNDO, Emundo technique. There are 3 steps here. One is photobiomodulation on the tissues, right? After that, put a dye and do the PDT. Third step will be debridement of the cellular epithelium. Sulcus is there. Take a 4 mm, 400 microns. कहाँ गया? Tip. I'll show you the tip. 400 microns. So into the sulcus, you just debride the cellular epithelium and name it as Emundo technique. Again, mechanic. The way you curate it, no, with the laser, you remove the laser tip. Will be debride the cellular epithelium. Very simple. It is not very difficult to start these procedures. It's very simple. Exactly. What you can do, the take 300 micron tape. I'll show you. 200 is extremely thin. 300 is little bulky. 400 is for cutting the tissues. 300 for perineal pocket. 200 for into the canal. So if you want to do indirect pulp capping or remove the only the necrotic pulp, do that with the fiber, and then go for whatever the procedure you start follow after that. Calcium hydroxide based or whatever the dressing give you, you can do that. And if you want to use the PDT, there is no harm. You can do with PDT and then follow with the rest of the procedure. Exactly. So,
direct CIP filling can be done. Yes.
ट्राई करो बिल्कुल.
Without using burr, we can debride the cavity and put the GIP.
You can use the RBM agglazer for that, because the depth of penetration of RBM agglazer is only 0.5 microns or 5 microns. Very, so there is no way that you can expose the pulp, but that will cost around 25 30 lakhs.
There will not be any problem.
Depth of penetration, again, it depends upon either you are doing it to the enamel surface or on the pulp, right? पल्प में अगर आप रखोगे तो नेक्रोटिक जो रिमूव कर सकते हो वो आप कर सकते हो, बट इफ यू आर टॉकिंग अबाउट द बर एंड द एक्सपोजर ऑफ द पल्प, better always go for
No, sir, I'm not talking about pulp.
uh,
I'm just talking that
no caries you can't debride. You can do the PDT and kill off the microorganisms there.
and then put the GIP direct.
You can do
Without
it.
using the burr.
You can see the main primary object is elimination of the excretion of the caries.
Bacteria problem.
Bacteria, yeah, bacteria will
Cavitated or non-cavitated, in the bacterial presence.
definitely you can try. You can remove as much with the burr, and when you're आपको लगेगा कि बहुत नजदीक है अभी, तो आप
But it is not alternative to the burr drilling method. सीधा ही हम इसको PDT
जितना मैक्सिमम आप बर केरीज निकाल सकते हो करो. डोंट रिले कंप्लीटली ऑन.
ART का feel certificate, sir, the burr is not effective. I was just thinking for the ART. Because reading public is
You can do it, because the microorganisms which are there, they are going to be killed. That's for sure. No sir, just give me one 60 seconds. Yeah, split कर दीजिए. Once it has जरूरत नहीं ना second patient. Okay. ठीक है निकाल. Yes. So we have like this 8 mm probe and 3 mm also. So whenever into the sulcus, always go for 3 mm. एकदम pointed रहता है, लेकिन their energy delivered will be much more. अभी ये गेट है, यहाँ से 100 लोग आप 1 मिनट में आते हो, इसका मैं गेट आधा कर देता हूँ तो आपको टाइम ज़्यादा लगेगा. तो जितना ये है उसी टाइम में आपको 100 लोगों को आना है तो कितने फोर्स से आना पड़ेगा, आप जस्ट इमेजिन करो. दैट विल बी हाउ यू कैन कोरिलेट, राइट. दिस इज 8 mm. हाँ, एकदम शार्प जो रहता है वो 3 mm का रहता है. सल्कस में 3 mm, बिकॉज नाउ आई डोंट हैव नाउ एग्जैक्ट. If there is a deep pocket, go for 3 mm. Or if there is deep pocket and if there is a pocket and you have 3 mm tape, lessen the time duration, right? और ये कहाँ का जो इसका लाइट स्प्रेड होता है सल्कस में, वहाँ माइक्रोवेव will have instant kill, right? Photosensitizer has to be used for the PDT to be effective. Only putting the PDT will not be effective, right? Start. ये नीचे, हाँ, और एक बार सर. यस, ओके ओके. लाइट बंद कीजिए चाहिए तो. उस तरफ देखिए सर, राइट साइड. यस. Contact mode. All PBM, according to the World Association of Laser Therapy guidelines, it has to be contact mode. For every millimeter distance from the contact mode, you will be losing 33% of energy. I told you yesterday. So whenever contact mode is not possible, keep it for a longer period of time to have the dosage. 6 joules अगर मैंने, if you want to move it, you can calculate like this. Scanning motion. Not, I will not say that none of the ALT members should have said this. The other speaker should have said this. No. The other speakers, Yaugal sir has not told this. Amit sir has not told this. And I have not told this. Because we follow the World Association of Laser Therapy guideline. Yeah, don't take the name. That's it. Always. Yes, definitely. It is again what I said, Earnshell's law. If you are in that therapeutic window, I will share that article with you. If you are in the therapeutic window of 2 to 4 minutes, you are going to do no harm. Maximum what can happen, it will have no effect. It doesn't do any harm. It will be having no effect if you are delivering the energy constantly. No harm. No effect, no side effect. No effect. If you are going for a lengthy period of time, there will be no effect only. Or in PDT, that stands to for PBM. PDT आप अगर 1 मिनट 2 मिनट किए, माइक्रोवेव से अपना काम कर गए, खलास हो गए, आप ज्यादा देने के बाद वो जिंदा नहीं हो जाएंगे फिर से. Exactly. And this is non-thermal. As long as I am staying within 500 here. This is 500. As long I am in 500, 400, 300, 200, 100, I am in a non-thermal zone. There will be no thermal effects. Once I press the now 600, I am going into the thermal zone. If I make it 1 minute, you can start cutting the tissues. You start vaporizing the tissues. 1.5 to 2, depending on the number of melanins or chromophores present. You can, right? Yes. Change. I will show you the tip, and I will show it on the tomato and goat mandible also. Exactly. Nowadays, it is not called hard tissue laser. It is called a dual laser, because it has not the only function of cutting the hard tissues. It can even cut the soft tissues. You have to just play with the energy levels. Energy delivered, right? I bet nobody will leave from here. Yeah, finish this. No, that is oral medicine demo. 300 milliwatts. This is the PDT, this one, for 60 seconds. How many joules? 6 3s are 18 joules. Right? If it is very deep pocket. अगर थोड़ा कम लगा आपको, 4 लगा, तो इसको 200 मिलीमीटर. All a matter of time you spend with the lasers. We'll come to know all new things. Now, before you came and now you are at a certain level, right? You know now certain things, how to do, how to go about it. After 4:30, 5 o'clock, again you'll do the cutting part also. You should be still more confident, right? If some are really interested in pursuing this laser dentistry further, you can join fellowship courses also. Choose your mentors, right? Choose your course. Not today. After 1 year, 2 years, whatever time. Average fellowship costs about that is in association of Asian Academy of Laser Therapy, Singapore, and European Academy. It costs only 55,000 plus we are. Duration, see, if Saturday, Sunday, this Saturday, Sunday, next Saturday, Sunday, next Sunday. 5 sessions or 6 sessions will be there. That will be the duration. If you want to complete, अभी February का Saturday Sunday, first week, second week, and third week. Over. Most of the courses are online. If you want to do one day hands-on course, you have to come to Hubli, or you can call us with 8 persons or some setup. I will come there with 8 to 10 persons. Right?
The accreditation or fellowship is required, the certificate is required, or even suppose we are learning here.
55 is the bare minimum. See what happens if any medical legal cases. No, you can start with the certificate course also. You take any one certificate and start with the because if you will not come in any problem. If at all you come, at least you have some certificates that you are capable to do it. You can handle it like that. So at least if you have a certification course, you are बच जाओगे ऐसा सर्टिफिकेट राइट सर एग्जैक्टली 55 कम कर रही क्या 55 1 day course 2 day course are there and if you want that is 1.65 how it works now that is international research fellowship that first you will get the fellowship of 55,000 प्लस जो 1 लाख का है वो आपको इंटरनेशनल रिसर्च प्रोग्राम में डालेंगे तो 2 सर्टिफिकेट मिलेंगे आपको एक फेलोशिप का और एक इंटरनेशनल रिसर्च फेलोशिप का वही चाहिए
Collaboration with some university or some
Euro Asian something like that. Yeah. Without what?
international research.
Associate fellowship 50%. And we are again talking with them for some more perks with this 55,000 only. It's not the right time to reveal. Give me another 10-15 days. I will come up with that if at all some. Yeah, definitely. I'd ask ma'am to add me also so that you are ma'am. Yeah. So they have many queries about the fellowship and international research fellowship. Yes. So this is PDT is over. Let's go to next case. So next we'll call it here only laser teeth whitening. I'll tell you the very easiest way. आपने थूका ना चलेगा. Tasteless. You can taste. Concerned about taste. It is in non-thermal zone. It is not going to hurt them. You can keep it on their palm and show them that it is non-thermal. Nothing will happen. You saw yesterday that lady how she was. दर्द होगा क्या कुछ होगा क्या later she is starting all the other places यहाँ पे भी है यहाँ पे भी है यहाँ पे भी है so you have to gain the confidence of the patients then they will be okay patient yes accept it yes what are the now teeth whitening Amit है Amit D4K gold whitening agent exactly bullseye because it is a carbon peroxide based we don't have hydrogen peroxide based so no need to worry the color change in ginger nothing is going to happen it's only going to act because it has got a higher molecular weight it is not going to do anything because you can try whatever company you want we never our carbon peroxide is coated with gold particles for better interaction You can laser. You can use this only.
Probably he wants to ask,
Ask for
it has to be coupled with laser or alone.
no. What she is again? Whether she with this laser can she use hydrogen peroxide base? Same procedure you can use. You can have the gingival barrier and use this laser 4 watts. And whatever the prescription on that Polo office or Zoom that light curing, most of the Chinese product which are using, it is not at all 430 nanometers. And you will blame the dealer or the person who has sold you something like most of the time it happens. Zoom light, you are going to put lakhs of rupees for the zoom light and LED based, nothing is going to happen. Don't use that. Lasers are always better than LED. Yeah. This one?
That can be used with a polo.
When laser is there with you, why you want to use pull office at all? This is the gold standard. Pull office is LED based. Once it hits the target tissue, gone. It can't have coherence and collimation. Don't invest in pull off. What is that? Zoom light. मटेरियल आपको जो भी है यूज कर लीजिए अकॉर्डिंग टू स्पेसिफिकेशन यूज कर सकते हैं नो प्रॉब्लम एट ऑल कोई भी मटेरियल अकॉर्डिंग टू देयर स्पेसिफिकेशंस यूज कर लो हाँ एग्जैक्टली डोंट यूज एलईडी फॉर ए दिस वन यू कैन गिव दैट एलईडी बेस्ड फॉर ए होम केयर अगर आप नहीं आ सकते तो होम केयर आप करते बैठो जैसे मैंने एमआई से दिखाया ना डिवाइस पेशेंट को दे दो एग्जैक्टली हाँ बेटा क्या करो बेटर Not very.
Lower ones are
Stains were removed it since yesterday. So you can. Exactly. Immediately after polishing, only you have to do the more effective. If you leave 24 hours, no, again there will be. Exactly. Internal bleaching. If 9 only you have to do internal bleaching. Again you have to go through the literature. Again you have to go through their standards. See, if you are comparing with 35% hydrogen peroxide and 40%, you can't have the same energy settings. They have their own instruction manual which you have to use. Yes. Shade depends upon the shade of the patient. If there are more stains and more like initial fluorosis patients, number of sessions will increase. Or stays the same. Number of sessions will increase. Don't be very harsh on the teeth. Just to have that instant wow effect, no? If you are telling the patient previously that it will take little time and will let's go very smooth on the it's on the patient on the teeth, they will understand. नहीं मुझको एकदम सफेद चाहिए तो लो सफेद ही के आपको पहले ही बोलने का है हाइपर सेंसिटिविटी होगा अगर आप इसके लिए तैयार हो तो मैं अभी आपको सफेद इंस्टेंट सफेद करके दिखाता हूँ इफ यू आर वेरी जेंटल ऑन द टीथ गो फॉर कार्बन पेरोक्साइड बेस
effectiveness is also better for this. I think cola office sometimes is not very effective.
it is effective but at what cost
I think I'm asking. It can
No,
be more
because-
effective. It is not very effective at times. Cola office.
at bola face नहीं
It is effective all the time. Not that is what I'm saying. That it should be effective. This is all. Okay. The brand name we should not be talking.
I can't. I am the. I am not.
Not and we are standing in a government college.
We have a cheek retractor.
So roll out.
depends upon the sessions and depends upon the pigmented. If the patient starts smoking or tobacco eating or is a chronic tea drinker, it all depends. You can't have the cause and effect like this. Many average of 3 to 4 months. See, exactly. It stands due to all. Duration it is not going to enhance. It depends upon your habits.
Side effects like hypersensitivity and rubber, dam barrier, that
Mostly. Okay. Okay, sorry. ऐसे ये थोड़ी अंदर जाएगी. You have to do like this, right? बस बस हल्का सा बंद कीजिए. बस ठीक है. Actually not enough. छोड़ दीजिए. बैठ करके रखिए. नहीं, it is going. This is आराम से.
Not able to come to the
He will come. We can use two individual single also if you have enough assistants at your disposal. You can tell your assistant to stand behind.
size can the cotton
Price is lesser. Okay.
maybe
Okay, no problem, no problem. छोड़ दीजिए. अगर आ गए तो मैं संभाल लूंगा उसको.
PH करते हैं PH पे करते
सेंट्रल इंसिजर कर लेंगे. ठीक. नहीं चलेगा. ठीक. नहीं छोड़ दीजिए आप. हाँ आया ऐसे कर दीजिए. ऐसे पकड़िए. यस. आई डू ऑन द अपर. Lights. I will show you on two teeth. Good. Good. Keep good. Yeah, already I can read the mouth mirror is there. Or you can use this tip to have a better spread down the. Exactly. We don't have enough at my disposal here. So I am. नहीं actually यहाँ पे सब रहना चाहिए. It is our fault also because we should have given them the dish whatever we require, no? Lightly. ये अब कहाँ गया ये? ब्लैक कवर था ना यहाँ पे. So if I am using a single teeth, I could have used this. Now I am using two teeth. I can use the prism. So what watt? कितना watt prism के लिए? No, here this one it will go to 5 watts, and no 6 if you take it will go for 6 watts. Just because क्या होता है, I can't go and preach everyone that 4 watts is enough. There are enough competitors who wants to who sell only with the option that 10 watts, 10 watts, 10 watts बोल के. So just to be with them at because 810 nanometers if you give 10 watts, no, you will be very brutal on the tissues. You are going to burn, char, whatever, do all the harmful level. And 4 watts. And just imagine persons buying directly from the dealer and starting their procedures. कीजिए ये 4th बटन प्लस नहीं, ये और एक बार और एक बार और एक बार नहीं, ये यही लास्ट है, ठीक है। और अभी आप यहाँ से जा सकते हो, दैट इज 4 watts एग्जैक्टली। यू गॉट टू, ये देखो अगर सर्जरी से एक्सक्यूज मी बस अटेंशन, अरे बाप रे लगा उसको। सी हियर, if I want to cut the tissue, I will start with 202 watts, or I have the option of 2.5, 3 watts. So 3 के बाद अगर मुझको 4 जाना है तो I will go on incrementally. Now I will start it. So see my laser energy where it is. I am not pointing it towards your eyes, right? This has to be taken care of. Light off, because it is in an infrared zone. You are not going to see. What you are seeing is the guiding light. That is not the laser light. It's a guiding light exactly where your laser should be. Where it is in 640 nanometers to 660, it is a visible range. There is no need of guiding light. So for this patient with not much of stains, 2 minutes is more than enough. Lightly higher, you have to go on increasing the duration, right? Maximum 4 minutes. What will be 4? But it is the whole prism length is 3.71. So if you are taking if you want to calculate it, you have to calculate with that 1 watt use कर रहे हो आप पर टीथ 1 watt यूज कर रहे हो, 1 watt into 240 seconds. What it? इतना ही है, हाँ कैलकुलेशन। अरे बहुत इजी है। Whenever protective glasses has to be worn at all time starting, because I have your attention here. I am not telling you to see it there, and that distance will not make any effect, right? So starting, wear protective glasses and then only start. Better, because I know what I am doing, right? Whenever I was using, I was keeping my laser energy here. If by mistake, if you put it towards the patient's eyes, just imagine what harm you are going to make it to the patients, right? All exactly, or infrared region. That leniency is there when you are doing PBM. You need not have to use the protective lights. Because visible is really photons per unit of area with the given duration is more there. As you go to, exactly. Eight mm, 1 watt. Because I'm going to use it only one teeth. 4 teeth, 4 watts. So the effective energy what you are going to calculate per tooth is 1 watt only. Got it? And it should be as close to the tissue as possible. These you can take a PHOTODYNAMIC and saline water or water and just water. You cannot open. Nothing is going to happen there. It is just a glass. आप जो मिक्सिंग स्पेचुला ग्लास वगैरह करते हो ना वैसे ही Please. हाँ. Anybody is calculating the time? Machine, what happens? No, I will tell you. In PBM, you have always have the privilege of having time at your side that will display because it is calculated. How can you decide on his frenectomy excision how much time you want? It depends on the fiber thickness, fiber length. So whenever you are in thermal zone, it will not display time. You have to decide or you have to time it. In PBM and PDT, you have that. So wait for just give me this tip. What way to do it here? No, now see this. Take this tip. Lights on. हाँ वो वहीं तक रखो ताकि आपको दिखे भी. तो मैं क्या कर रहा हूँ ऊपर नीचे कर रहा हूँ उसको जो ऊपर था मटेरियल उसको नीचे ऐसा ग्रेजुएट कर रहा हूँ. सब जगह होने के बाद ऐसे अभी ये जो मैं कर रहा हूँ ना 15 मिनट आपको रुकना है. इमीडिएटली नहीं करना है. 15 मिनट के बाद हाँ पकड़ के रखिए. 15 मिनट के बाद एग्जैक्टली जो ऊपर का मटेरियल अंदर अंदर का मटेरियल ऐसे उसको ये कर रहा हूँ एजिटेट कर रहा हूँ. दैट इज कॉल्ड एजिटेट. फर्स्ट एक्सपोजर वेट फॉर 15 minutes, agitate like this and again wait for 15 minutes and then let him rinse or take the cotton, first wipe it everything and then he will rinse, right? So now suppose we have to after 15 minutes, yeah, 15 minutes agitate it and again आप लगाइए 1 2 3 4 1 1 2 नहीं 2 नहीं. क्या हो गया इसको? I have one more जुगाड़. Two, 3, go on incrementally. Very simple. Okay. See here, where is my laser? It is not pointing towards the patient's eyes or my eyes or your eyes. Right? I will catch it here and then directly take it here like this and then release it. Right? You have to go to the website, Vault, and read laser safety guidelines. We are speaking with one laser safety guidelines company abroad, so that with the 55,000 course, you will get this additional certificate also. They will train you online, you will get one more additional. So number of editions are increasing slowly. 8 days. No, the same guidelines for laser safety, no, we are trying to give it only with the fellowship also. But don't make it viral yet. We are just in talks. We'll get to know within some days. So this is again, you have to do 15 minutes. Got it? Let me do at least for 2 minutes. What happens, no, if I keep it for 15 minutes on only 2 teeth, next day patient wakes up and sees that only the two teeth are वापस आएंगे. We can do this as a patient motivation and education also. एक बात करके भेज दो, he will feel the difference, he will come back again. But don't do it anterior. No, this patient has got even distribution. He doesn't have much stains. If you do that, is really need discolored teeth. The patient will not come for you. He'll come to have a verbal argument with you. This teeth are white, no problem in this. Facial aesthetics, you need very shallow doing it. You can do it for ek vulgaris. Put a drop of dye and you can do that, but not on facial. That derma and depigmentation, those again are I've got different settings. See the way I'm talking to you, my laser is all covered always. I'm not going to point it like this and show you like this. So this, nahi, cotton bhi hai. And these lasers are so powerful. Whenever the patient has got a fracture, if you put it on a plaster, they will penetrate the plaster. So just to make you aware that how powerful the lasers are, be very careful. Hmm? Yeah, this is thermal. Exactly. No. It is only on the again you are using one wet here, and you are using it on the tooth, not on the gingiva.
Because of this
Prism. Hmm? So now it is the laser machine is warm. You have to I'm using it the 4 watts continuously, so it will warm and it will give us a warning. These all laser safety protocols you'll come to know once you can shut down. Exactly. Shut down. Yeah, you can stop it and then do it, because I can't every time come here and get a lecture. Exactly. I will take the little cotton now. I'll just have to wipe this like this. Abhi light लगाओ.
for facial procedures it can do, but with different settings.
Exactly. Those are
That you
entirely
have to-
different
you have to
lasers. Read exactly.
हमने शेड रिकॉर्ड नहीं किया तो ये तो डेफिनेटली
निकाल दीजिए. आईना है तो पेशेंट को दिखा सकते हैं, आईना नहीं है यहाँ पे.
तो मैं सेल्फी देखेंगे.
The disadvantage of using mobile in a selfie mode, you'll get a horseshoe shape. Horse का मुकड़ा रहता है ना वैसा है. The magnification is not even 1:1 as we see in DSLR. DSLR 100 mm का लेंस अगर लगाएंगे आप, तो you will get 1:1. जितना दांत है उतना ही दिखेगा. यहाँ पे कैसे होगा, सामने वाले दांत बड़ा दिखेगा और जैसे जैसे पीछे जाएंगे आपका ये हो जाएगा. So whenever you want to start, again invest in DSLR camera also. DSLR से तो रहेगा आपके पास. You can always start. There is never